If you've ever had a patient give you their insurance card for the services for that day, only to find out after billing the claim that either they're not covered at all or they're not covered for those particular services, then you're probably just like me. It has happened before. I hate to admit it, but it has happened before. And this is because either the front desk or yourself has not checked eligibility or verified benefits for that patient. However, don't worry about that. In this video today, I'm going to talk about eligibility and verification and what you need to know to not let that happen again. Keep watching. Now, there should be no reason that this is happening to you right now in 2024 because of all the technology that we have. So I'm going to first go through what eligibility is and what verification of benefits is. So eligibility is when you check to see if a patient is covered under a specific insurance plan for a data service or a time span. You want to know if their coverage is active for a particular date of service. Now, verification of benefits is when you determine what services the patient's policy covers and what the payer and patient responsibility are. I wanted to go through those two definitions because people tend to mix those things up. They are not the same thing. One is checking to see if a patient even has a policy, and the other one is checking to see what services are covered under that particular policy. So here are a couple tips for you and the front desk for when you are dealing with eligibility and verification. And the first tip is that eligibility should be done for every single visit. Not every single patient, but every single visit of every single patient. So regardless of if the patient came in yesterday, a week before, a month before, a year before, you should be checking eligibility on that patient each and every time they have a service done in the office. You may say, well, they just came yesterday and it was covered. They were covered under the plan. Why am I continuously checking? You are continuously checking because at any time their policy could be terminated. Yesterday you might have checked and it said that they were covered, and then today you check and they're not covered. So just to be on the safe side, you need to check eligibility on every single visit. And then when it comes to benefits, you can make sure that you check benefits initially when they first give you the insurance information. When there's a change in their policy plan, you can check benefits. And also when there are particular procedures that you're trying to find out if they are covered, then you can check benefits. Now, this is not to say that you shouldn't check benefits other times, but those are the 3 times that you need to check them. Now, I've gotten from some people that they just don't have time to check eligibility or verify benefits. For me, that is unacceptable. You need to make time to do these things, and especially, again, to check at least eligibility. So I'm going to give you 5 ways that you can check eligibility of a patient's insurance. And the first way is through your practice management system. So nowadays, because of all the technology that we have, some practice management systems are integrated with the payers, meaning that you can check eligibility through your practice management system for each and every payer, or for the majority, because they like to say each and every payer, but sometimes payers don't allow that to happen. So if you can check eligibility through your practice management system, then you need to make sure you make that a part of your workflow. So when you are maybe making an appointment or you are checking the patient in, you just check to make sure that the patient is eligible for their insurance coverage. Now, some practice management systems who have that capability also have the capability of automatically running eligibility for you. Again, different softwares have different capabilities. So some you may have to initiate it, others may initiate it for you or set it for you, but it just depends on what practice management system that you are using. The second way is through your clearinghouse. Now, if you have the capability of doing it through your clearinghouse, or if you've added that service, because a lot of clearinghouses don't just offer you the eligibility service. They usually offer you it in addition to some extra money. So if your provider said, okay, fine, we want to be able to send claims, but we also want to check eligibility, you may have the capability of doing that. And that's similar to the one of the practice management system, where it may check eligibility for you automatically, or you may have to check it manually yourself each time, maybe click on each patient's information just to make sure. But either way, you need to make sure you put that in your workflow in order to make sure that the patients are eligible for coverage. The third way is through the payer's website. For example, Cigna has it where you can go onto their website and you can check to see if a patient is active, eligible, what services are covered. So you would have to go into that particular website, for instance, Cigna4HCP.com, log into your account and check for all the patients who have Cigna. In this instance, you won't be able to check for all of the patients at one time. You'll have to check for those patients that have that specific insurance. So it may take a little bit longer, but you can do it. However, sometimes payers don't have that capability of doing it through their website, but most of them usually have, and you can have it to where you can do it that way. Also, doing it through their websites are most likely free, and where the other options, such as the clearinghouse and the practice management system, you will probably have to pay a little bit additional money for that service. Now, I'm sorry, my puppy is here, as you can see, but hopefully he'll stay a little quiet and we can continue on. The fourth way is through the IVR for that specific payer. So you can call the IVR of, let's say, Blue Cross Blue Shield, put in the patient's information, such as, ID numbers, date of birth, all of that stuff. And then the IVR can give you the patient's effective date and benefits. Again, this way is free. It takes a little bit longer than the other ways, such as, doing it automatically through your practice management and even going to each individual website. It takes a little bit longer because now you have to do it individually for each patient that you have. But again, it's free and it's a way that you can check. And last but not least, you can check by calling the payer, just like with the IVR, but instead of going through the IVR, you actually speak to a representative. Now that takes the longest because now you have to be on hold and wait. And most representatives or most payers don't allow you to do a lot of eligibility checks, like 10, 20 patients if you have in a day. You would have to continuously call back because they only allow you to do a certain amount. So that would take the longest. I would not recommend doing it that way, but sometimes you have to. Sometimes your system is down. Sometimes you just can't do it the other ways, and you have to know how to be able to get eligibility checked because, again, there's no excuse not to, and you should always do it for every visit. Now, let me throw in a sixth one, and I didn't put it in the list because I don't really like to use it, but there's also companies such as Navinet and Availity that are institutions that are outside of the payers, but they are integrated with different payers. So if you go through Navinet, you can check Blue Cross Blue Shield, Cigna, United Healthcare, all of the payers within this one website. Now, I don't use that because I live in the Virgin Islands and it is not beneficial for me as far as I can look. I've tried it several times to be able to have one site to go through to check insurance, but they don't have access to certain insurances that we use, and it's kind of a waste of time. I already set up, my Cigna login and my United Healthcare login, and if I can't go to those payers through Navinet or Ability, then there's no sense in doing it. But I've talked to a lot of other billers, and they've told me, like in the States, that they can use it and they like it. So if you can use them, then that would be a good option for you. Now, what are you looking for when you're checking eligibility or verifying benefits? So there are 7 things that I look for when I'm doing this. And the first one is the patient active? That is first and foremost. So if you call or if you go online and the information says that the patient is inactive for that data service, then there's nothing else to check really. I mean, you can check when it was terminated, but pretty much they're not going to be covered for that data service. The second thing that I look for is the effective date and the termination date if they have it. So the effective date, of course, is important because if the patient is having services done on the 15th of the month and their coverage is not effective till the 16th of the month, then they will not be covered for that specific date of service. Now that does happen. Sometimes patients give you a card and they think that they're covered from, the first or something, and they're not. So you have to make sure that the effective date is going to be before or on the date of service. As far as termination is concerned, some policies show it. Sometimes I've seen them show it. Sometimes they don't. So termination is not necessarily important unless the coverage has terminated already. And then you need to know what the termination date is. Also, when it comes to effective dates, you have to remember that sometimes insurances retroactively terminate policies. Now, I completely understand if you hate that, because I hate it too. But sometimes you might have called up on a patient or looked up a patient and it stated clearly that the patient was covered on January 15th. And then you send out the claim and you get back a denial saying that the patient is not covered. So now you're confused. What are they talking about? Then you go back, let's say on the website, and now you realize that the patient was not covered on the 15th. Their policy ended the month before. And you're saying to yourself, I know I checked this. I know I checked it. They were covered at the time. What happened? And what could have happened is that the insurance company retroactively terminated the policy. So at the time that you looked for the information, the insurance said that the patient was covered, but something happened in between that time. Maybe the patient's job sent in something saying the person was terminated, and then the insurance retroactively terminated the policy. But I have found in a lot of situations that they have done that, and then it becomes the responsibility of the patient because now they have no coverage when we thought that they had coverage. The third thing I check to see is the policy a calendar policy or a plan policy? Meaning, is it from January to December, the calendar year, or April to March, which could be a plan year? The importance of this can play off of the deductible. And if you don't know about deductibles, check out the video that I did on deductibles explaining all about it. But you want to know when the deductible information will start over or when the plan will start over. So this information is important to you. Also, if you check the policy and it says that the effective date is August 15th, that doesn't mean that that is the policy's plan year. Okay, so just because it's effective on August 15th, it can still be a calendar policy where it goes from January to December, or it can be a plan policy where it goes from August to July. So you still just need to check to see if it's calendar or if it's a plan policy. So the fourth question that I asked is about my practice. What services do we render? Now, most practices do office visits, so that's a common one. But you can also do other things like procedures and draw blood and give injections and all those other things. So you need to know what services that you would be giving to the patient so you can know what to ask the representative or what you can look for on the websites when you are looking for it. Next, you probably want to also get just like generalized benefits as far as deductibles, co-pays, co-insurances, out-of-pocket, stuff like that. So if you need to learn more about that, you can watch this video up here that explains all about what co-insurance, co-pays, all of those things are. These are some of the things you might want to just know generally. I just want to know, if we do an office visit, what's the copay? If we decide to do a procedure in the office, what would cover it? How much would they cover? All of those things. At that time, you would want to know what would the patient responsibility be and what the insurance responsibility would be. The sixth thing I would want to know is about a specific CPT or HCPCS code. If there is a service that we're trying to give that I need to know specifically what they're going to cover on that code, then I would either search that specific code or I would, ask the representative about that specific code. Sometimes you may ask general benefits, like I told you in the fifth one, ask general benefits, copays, co-insurance and stuff. But sometimes you know specifically what you want to do, so you want to give them that specific code so that you can give the patient a more detailed, definitive answer. And last but not least, I would ask about pre-authorization. So as far as office visits, most payers don't require, authorization for office visit. Now I say most because anything is possible and insurances do what they want. But for the most part, you don't need a pre-authorization for office visit. But there are other services that you do need pre-authorization for, and you want to know what those services are. You don't want to just start doing something on a patient and then come to find out you can't get paid because you did not get it pre-authorized. So depending on your specialty, you need to find out what services need to be pre-authorized and what services don't need to be pre-authorized. But if for some reason checking eligibility and verifying benefits slips through the cracks, you will probably get a lot more patient statements. And if that's you, you need to check out this video right here talking all about patient statements and what you need to know to get paid. So I'll see you again in my next video.